Hello, I'm Dr Bornali Datta. I work as Director of Respiratory Medicine in Medanta, the Medicity. Now I'm here to discuss mental health and tuberculosis today. Now all of us again focus exclusively on diagnosing the disease and treating the disease, prescribing the treatment, and we think our job is done. But what we fail to recognize is that mental health is a sizable problem that accompanies the diagnosis of tuberculosis in various forms, and I will go over that with you. And it is important for us to be aware of that. Now the first thing to point out is that tuberculosis and mental health almost exist like a co-epidemic, almost like TB and HIV, for example, except that we don't recognize it, we don't acknowledge it, and therefore we don't address it either. So it is important for us to be very aware that a patient can get into a vicious cycle because of this coexistence of tuberculosis and mental health illness. Now, a person with mental health illness is more susceptible to developing TB. A patient who develops TB can go on to have mental health issues because of the stress and the stigma related to the disease. Additionally, drugs can cause mental health illness. For example, cycloserine, which is used as a second-line treatment for drug-resistant TB, can cause psychosis, can cause significant mental health issues. And if we are not aware of this, we can't prepare our patients for this, and therefore we can't treat them for the same thing. Now, so therefore, a combination of all these factors, long duration of treatment, the isolation and stigma attached to the disease, all contribute to the patient developing a decent degree of mental health stress and illness. Now, it is very important for us to make the patient aware of this. And how do we go about this? So the first thing is that we have to make the patient aware of these issues of mental health illness and the fact that drugs can sometimes cause psychosis. We have to sensitize both the patients and the families to anticipate that there might be mental health issues related to the disease, to the drugs, and to the social and mental impact of the illness. Now, only when we explain it to the family and patient will they be aware of it, will they seek help for it. The other thing we can do is behavioral screening for patients at the outset, and we can identify mental health illness early and thereby put them on the correct treatment. Providing regular counseling to such patients is also important from the mental health perspective, TB perspective, and we help them adhere and complete treatment as well. Remember that mental health illness has a direct impact on ensuring completion of TB treatment. So a person who is mentally unwell, who is depressed, has low mood, has no motivation to take TB treatment. So it's very important for us to address that aspect, and that will ensure that the patient completes his treatment, adheres to his treatment, and gets complete recovery. So remember that it is our job to help patients address their mental health illness, because if we don't, then who will?